Sure, Prashant. Thank you so much for the opportunity. Hi, everyone. I'm Dr. Anupama from India. Welcome to this session and Happy New Year to all of you. Uh, I'm basically a dental surgeon working in private clinic and as well as in the government sector as a public health officer. So, being a dental surgeon, even as Prashant said, even I had not looked after myself. And a few years back, even I was associated with the wellness quotient community, and I could reduce around more than 12 kgs within 3 months. And I've maintained it. I have not increased even 500 grams after it. Still, I'm reducing. Along with that, I had lots of I was suffering from migraine. It was severe and it has been reduced almost, I can say, around 90%. This is how I got completely into wellness community. And meanwhile, when I got results in me, I started working on my family members, my friends, and I've got results in almost all the chronic diseases which we see, which we come across in medical field. So I'll be presenting you people now the one of the testimonial, that is diabetes reversal. It had happened long back in my this thing, so I don't have before and after picture, but I have the reports with me, like whatever I had taken, I mean recorded. So I will be sharing with that. Yeah. So in this, this is the first, previous one, the first one. So actually, that person called Mr. Venugopal he was around 54 years previous, sir. Sorry. Another one. Another one. Which in this, in which actually the Venugopal, the person who came to me in 21 2021. Yes, sir, exactly this one. Okay, in this, like you people can notice, actually I have written down the values and I'll be telling you can see into that. When he came, his FBS was like 198 and PPBS was 354 and his HbA1c was 11.4 when he came to me, and he was with 500 grams of metformin twice daily. So he had taken for few days, nearly a month, and some of my friend advised him, why don't you go and meet her? So he came to me. So he had grade 1 fatty liver. I mean, later on when he came with that report, I had written some more investigations because I wanted to know his what exactly the strength of his body. So I wanted his serum calcium, protein, vitamin D, vitamin B12, liver function, and all other, like because of diabetes, like I need to know about renal functions, cardiac functions, everything. I got that, like he was like grade 1 fatty liver, and his vitamin B12 was 278. Like it is, even though it is normal, but it was in the lesser side. And vitamin D was 15.2. It was like he was deficient of. So then I started working on all those things. Later on, I'll just present. So next slide. So I'll just present, like after that, like it was 2 months. I gave him the diet patterns. I added him with a few supplements because he was deficient of few stuff. So later on, within 3 months, his fasting was 128, PPBS was 133, and HbA1c was 7.2. He was really very, very happy. Like in this 3 months of gap, like every week we used to get the test like fasting and PPBS with the glucometer, and it used to be in the lower side. So he continued, like it was results was awesome. He continued the program. Then like after 6 months, like it's almost like fifth month he came, and 11th month it was almost reversed. His fasting was 117, PPBS was 121, HbA1c 1 or A1c was 6. And later on it came below 5.2 also. Like right now I don't have the report to show you people. But how it happened, it's almost like 6 months to 7 months journey. He continued each and every day. He was there with me, and he was such a consistent, and he was such a religious patient. He used to send his findings, like his whatever he has done regularly, used to share with me, and I used to follow with him. So what all we did with him, we did all the lifestyle modifications. When I went through his details. His food was not good. His water intake was not good. There was no salad in his food. There was no proper diet, like proper complete, like protein. There was not much of protein in his diet. And his dinner was to be used to be late and late night. Cooking method was bad. The belongingness was really bad. Sleep pattern was disturbed. He was not having sleep at all. So even he was stressed up with financial issues, family issues, so many things. So you can look like so many things were there, and we worked on each and every part of his negativeness in his life. And we need to add up all the, I mean, along with this, like organic supplementation, as we give to any other deficient people, like protein, multivitamins, good fat like omega 3. We need to supplement him with vitamin D, vitamin B, and fiber, all these things. But it gave an amazing results, and it's been reversed. It's like when I took its value, it is 2021. Now it is 2023. Is out of medication and is really very happy. In this journey, he had reduced around 12 kgs and is really, really very happy with the results what has happened. So doctor, seen so many people around us, if we give little bit time, the blessings what we are getting from him and his family, it's like really awesome. Treating the particular thing is different, and reversing the disease itself, disorder itself, it gives immense pleasure to us and blessings to us. Just we need to give them little bit more time other than how we practice regularly. This is what I wanted to share, Dr. Prashant. Thank you for the opportunity.